Hi, this is Liz Krajewski, and for this project, I'll be looking at a data set from healthdata.gov describing various measures for Medicare beneficiaries. Several elements in this data set pertain to chronic conditions. I found this data set interesting because in 2015, Medicare made several changes to help manage costs for beneficiaries suffering from chronic conditions. More than 80% of Medicare beneficiaries suffer from chronic conditions, so impacting this population is significant. In order to protect patient PHI, this dataset looks at every Medicare beneficiary and groups them into different profiles that can then be explored. So there's 12 different chronic diseases available to explore. And if I scroll up here, you can see those 12 conditions here. We have cancer, Alzheimer's, chronic kidney disease, COPD, depression, diabetes, etc. And what I found most difficult about using this data set was that I wasn't able to easily create visualizations that explore measures across these 12 conditions. And that's because each condition has a value of 0, 1, or null, so it creates multiple dimensions when I add it to a graph. The only way I could find to get around this was to create a calculated field where I first filtered out the null and zeros and then averaged the measure for only those beneficiaries who did have the chronic condition. I used this approach to build a visualization that explores average inpatient days for all 12 conditions. It was a time-consuming process to build that out, but I found it worthwhile because this turned out to be my most interesting visualization. When these diseases were charted to compare beneficiaries who were dual eligible against those who were not, dual eligible members had higher inpatient days for every physical condition but lower for the two mental health conditions, Alzheimer's and depression. So you can see here as an example, members that are not dual eligible, the days are always, inpatient days are always lower than those who are dual eligible, except where we get to depression and Alzheimer's. So depression is pretty small, but Alzheimer's, it's a little bit bigger. So it just makes me wonder if low-income individuals that have mental health conditions are getting adequate care to treat these conditions, or if these mental health conditions just don't result in hospitalizations. So let's take a look at the dashboard. And I'm going to go into presentation mode here. Okay, so I've listed the hypotheses that and color-coded them based on what the data displays. So these are the hypotheses that were explored, and for red, the hypothesis is completely wrong, and we didn't have any of those. Yellow means the hypotheses proved out partially, and green means the hypotheses proved out fully. So let's take a look at these hypotheses. So first of all, we had a hypothesis that said low-income beneficiaries will have higher Part A cost and lower Part B cost. And we can see that displayed over here. So Part A are the teal-colored columns, and Part B are the gray-colored columns. And you can see that lower income beneficiaries will have higher Part A cost, but they also have higher Part B cost, so they are getting both outpatient care at a higher rate as well as inpatient care. So I coded this yellow because it was true that Part A costs are higher, but Part B costs are higher as well. So this was partially true. The next one, as Medicare beneficiaries grow older, I had the hypothesis that Part A cost and drug cost will increase, while Part B cost will decrease. The thinking there was that as patients grow older, they will reduce visits to primary care physicians because it's harder for them to get there, and instead resort to more inpatient hospitalizations as their health deteriorates. And I also assumed that prescription costs would increase as health deteriorates with age. And what I found is that's actually not the case. I also found it was very interesting that those beneficiaries under the age of 65 had the highest cost across all age groups. And this makes me wonder if perhaps members went without insurance for a while until they became eligible for Medicare, and then as soon as they became eligible, perhaps they had high utilization because they hadn't been treated by a doctor for a while, so it prompted them to address a lot of needs that had gone untreated for a while. But then after that, we can see a steady increase in Part A cost as a beneficiary ages, and a steady decrease in Part B cost once we get to those more advanced age groups. But what surprised me the most was that prescription cost decreased as age groups went older, the average prescription cost. So this also raises a lot of questions. Are older people simply giving up on taking medications? Perhaps they don't have the means to get the medications. So a lot of unanswered questions created by this visualization. And then lastly, beneficiaries with 2 or more conditions will have higher costs than those without 2 or more chronic conditions. And we have this toggle button up here to look at that. So if I select 0, meaning they have fewer than 2 chronic conditions, you can see the cost are roughly $1,600 for between $1,600 and $2,000, depending on whether or not they're dual eligible for Part A, and then roughly $3,000 for Part B. And you can see the inpatient days are all on average less than 1, even with chronic conditions. And we can see those average payments by age bracket over here. Part A still continue to be somewhat high. Part B are pretty low, and prescription costs are pretty low. But as soon as we go and look at the population that does have 2 or more conditions, we see significant increase in both Part A and Part B cost. We can see that now average inpatient days range from a low of just over 1 to a high of almost close to 2 inpatient days when they have 2 or more chronic conditions. And we can also see a big jump in the Part B cost and the prescription cost. So I'll just toggle this a couple more times just to really give you a chance to take a look at those differences. So cost, number of days, and then down here you can see cost by age bracket. So again, just going back and forth a couple times, you can see those visualizations change significantly as we go from fewer than 2 conditions to 2 or more conditions. So in summary, we can clearly see the significant increase in cost and utilization resulting from an increase in the number of chronic conditions. So this really supports the actions taken by CMS in 2015 to incent primary care physicians for proactively helping their patients manage their chronic conditions. This increase occurs in both standard Medicare populations and dual eligible populations. In general, dual eligible patients incur more expenses, so programs to address low-income needs may be the next initiative for CMS to pursue. So thank you for watching this, and I hope you found it interesting.